morning, sir. I am J.M.Perez, and I'm here to perform assessment of chest and the lungs of the patient. First, I need to assemble all of my equipment, which is stethoscope, skin marking pen, and tape measure. After assembling all of my equipment, I need to read the patient's chart, provide baseline data. After reading the patient's chart, I need to perform hand hygiene to avoid cross-contamination. After that, I need to identify the patient, introduce myself, and explain the procedure that we're going to do to build a rapport. Good morning, sir. Are you J.M.Perez?
Yes.
Good morning, Sir Marcred. I am J.M.Perez. I'm here to assess your chest and lungs. Are you okay with that?
Yes.
So after that, provide client's privacy. Closing the door, closing the curtain. And after that, ensure that the temperature in the room is warm because the body of the patient is exposed. And after that, put the client in the sitting position and assess the respirations of the client by counting the respiratory rate, depth, and the symmetry of the chest movement of the patient. So, the patient have normal respiratory rate. Usually, we don't tell to the patient that we're going to take their respiratory rate because sometimes they fake their respiratory rate. That's why we don't tell them that we're going to take it. After that, inspect the chest of the patient in lateral diameter, angle of the chest, and the spine deformity, respiration effort, and check if there is any skin lesions in the patient's chest, if there is any wounds, stretch mark. As we can see, there is 1, 2. So take note about that lesion. And after that, we need to palpate the trachea using our thumb and our index finger. And take note the position and distance between trachea and sternocleidomastoid. After palpating the trachea, now we're going to palpate the chest wall of the patient by using our fingers and hands. Place your both fingers and hands in the chest wall in the anterior chest of the patient. Inhale, exhale. Inhale, exhale. Next, in the lateral side of the chest of the patient. Inhale, exhale. Inhale, exhale. So check the chest expansion of the patient. Inhale, exhale. Inhale. After palpating the chest wall of the patient, now we're going to palpate the base of the chest of the patient. Use your fingers, spread your fingers in the base of the chest of the patient, and the thumb must be separated. The two thumbs must separated at least 2 inches or 5 centimeters in 8 to 10 ribs. Sir, inhale, exhale. Inhale, exhale. Check for the chest expansion. Inhale, exhale. In the posterior side of the chest of the patient, put your fingers again and create a skin fold using your thumbs in the spinal cord. Inhale, exhale. Inhale, exhale. Okay, great, great. After that, we're going to palpate the tactile fremitus of the patient. If there is any. So, in palpating the tactile fremitus, we're going to use our palm only. Inhale, exhale. Inhale, exhale. You can use the 99 method too. Tell to the patient to say 99 and check for the vibration in the chest. Note the level where is the tactile or the fremitus is palpable.
99, 99, 99, 99.
Note the level where is fremitus is palpable. Inhale, exhale. Inhale, exhale.
99, 99, 99, 99.
Okay. So, after that, we're going to percuss now the chest of the patient. In percussing the chest of the patient, we're going to place our fingers in intercostal space of the chest of the patient, not in the bone of the patient. First, in the anterior side of the patient, we're going to compare the left and the right and the left side of the chest of the patient. First, in the anterior side. Now, in the lateral side of the chest of the patient. And now, in the posterior side of the patient. And after that, after percussing it, now we're going to percuss the chest for the diaphragmatic excursion. In diaphragmatic excursion, first, in the posterior side of the chest of the patient, we're going to instruct the patient to inhale and exhale and hold the exhale and percuss it and mark it where the chest, and next to inhale and hold it and mark it again, and we measure it using tape measure. Inhale, exhale, hold it. Exhale lang, exhale lang, exhale, exhale. Huwag kang hindi. Now inhale. Now we're going to measure the two using centimeters. So usually the diaphragmatic excursion is 3 to 6 centimeters. And the patient have a 5 centimeters. So that is normal. And next is auscultation. In auscultation, we follow the percussion, like what we do in percussion. We follow the step like what we do in percussion. So in auscultation, use the diaphragm of the stethoscope. And now, again, the compares the chest, left side of the chest and the right side of the chest. Inhale, exhale. 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 Okay. In the back. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Okay, great. And now, we're going to auscultate the voice of the patient. If there is any long conjugation. And, and now, in bronchophony, we're going to check the patient. We're going to instruct the patient to tell 1, 2, 3. 1, 2, 3. 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
May problema kayo. And next is the egophony. In egophony, we instruct the patient to tell the word E, so we can check if there is any problem. E, 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 and next is the whisper test. We're going to test the patient, instruct the patient to tell whisper 1, 2, 3. Usually in the whisper test, we're going to hear a high pitched note. Just whisper 1, 2, 3.
1, 2, 3.
Whisper. And after auscultating, document all the data. And that's all. Thank you.